You're listening to the Imposter Roster, The Secret Lives of Capable Women. I'm your host, Christine Chabenko. You know that voice in your head, the one that whispers, "How did I get here?" Like at any moment, someone's going to tap you on the shoulder and say, "Oops, we meant someone else." That's exactly what we talk about here. Each episode, we sit down with a high achiever who's questioned whether they deserved to be there and then tell us how they rose anyway. So let's get into it. My guest today is someone who has quite literally dedicated her life to helping people lift, reach, and throw without wanting to cry about it. Dr. Stephanie Mu is a board-certified orthopedic surgeon specializing in shoulder and elbow pathology. She earned her medical degree from Drexel University, completed her residency at Henry Ford Hospital, and pursued fellowship training at Case Western Reserve. She's a member of the prestigious Near Circle, an associate editor for JSES International, and has served on committees for both the American Orthopedic Association and the American Shoulder and Elbow Surgeons. She's lectured on multiple continents, participated in international traveling fellowships, and authored more than 90 peer-reviewed publications, several of which have been finalists for Best Clinical Research Awards. Our Detroit, our local magazine, has named her a top doc multiple times, and she's about to join the University of Pittsburgh's Department of Orthopedic Surgery. Dr. Stephanie Mu, welcome to the Imposter Roster. So, Dr. Mu, 90 plus publications, international fellowships, top docs, and yet here you are telling the story they don't put on a plaque. So, how does this come to be? Can you just give me a little bit of your background, like why orthopedic surgery? How did you get to that?
Yeah, thanks for having me on the show. That's a question I get all the time. And to be honest with you, I think it's been my path my whole life. I can't say I knew it, but I can tell you in the third grade, when we were told to write what we were going to do in the future, what we wanted to be when we grew up, a lot of people wrote firefighter or teacher or policeman. I wrote I wanted to be a bone doctor. And this was in the third grade. I actually don't remember this. All right. But my elementary school teacher found me after medical school graduation. And after I found out I was going to orthopedics, she actually had the letter still and gave it back to me and showed me in the third grade. That's what I wrote that I wanted to be. And I didn't really know what a bone doctor was at that time.
I was going to ask you, so like, how does somebody come up with bone doctor when you're 8?
Yeah. I've always been a rambunctious kid, always doing sports. I did martial arts as a young age, and I was always in the doctor's office for some sort of what I found out later, orthopedic injuries. So I'm sure that had an impact as to what I wanted to become. I was fascinated by them kind of getting me back on the field or back into sports and letting me, heal and get back to doing what I enjoyed doing. And I knew that that's something that fascinated me and something I wanted to do for the rest of my life.
So when you decided, as an adult, okay, I think this is the route I'm going to take, were there any concerns? Because being a doctor, that's a long, hard path. And it doesn't matter what kind of doctor. But, an orthopedic doctor, there's a lot. Were you concerned about that?
Yes. When I first said I wanted to go to medical school, I was naive. I have no one in my family who's in medicine. I don't really have friends who are doctors or their parents that were doctors, but I just said I wanted to go to medical school. And it was only when I started looking into what it took that I realized the path I was choosing. And then the reality was I didn't know if I'd get the test scores that they needed. I wasn't a straight A student in college. I did well, but I wasn't on the dean's list every single semester. Um, so I just wondered, was I good enough to be a medical doctor, even though I knew that's what I was meant to be?
That's what I'm really glad you brought that up. This grades thing. Yeah, grades. Are they important? Well, they are certainly an element of determining if this is the right path for someone, but now that you've been in the field for so long and you look back and you might not have gotten that, 100 or 4.0, did that make a difference in what you do today as a professional?
No. I mean, it's obviously you have to have some level of knowledge and some ability to be able to learn. There's a certain level of
Mm-hmm.
skill that has to come with that. Does that come with grades? Not all the time, because test scores are a reflection of test taking abilities. And there's a lot of research out there that show test taking abilities are often related to other societal factors that are not um, available to all people within our society.
Yes.
So there are many things that certain parts of our society have access to that others don't. That means that they can possibly do better on a test. That doesn't necessarily mean they're smarter or better for the job.
Well, given your work as an orthopedic surgeon, and I think the fact that you said at such a young age, not even really knowing what that is, that I want to be a bone doctor, the passion that you have, would you say that's really what is propelling you to do the things you've done so far? Because let's face it, it's not like you're 75 years old. You've already accomplished so much in your field. You are one of the top specialists, and that's not just for the Detroit area. I know that. So, I mean, would you say it's really, yes, the grades, to your point, they matter, but the passion that you have for what it is you want to do because it's helping people, that's really what makes you the good doctor, yes?
Absolutely. I mean, one thing I tell people is that this isn't a job, this is my life.
Yeah.
The reality is I eat, breathe, and sleep in some way orthopedics because that's just who I am. And that's what brings me joy with what I can do, whether it's teaching, whether it's mentoring younger people, whether it's helping my patients and seeing the outcomes I got, that is what drives me to be the best person that I could be out there and drive the medical field. One of my continued passions is to continue to innovate and push the field of shoulder and elbow surgery to the next level. And you can only do that if you're passionate about the topic.
Well, I guess that's true because the technologies, I mean, you must be reading a whole lot of white papers and doing a lot of research on you're busy doing your patient load and your surgeries, but you're also having to spend time reviewing what's coming up so that you can figure out, how do I integrate this into my practice? How do I help my service be better to those who need it, right?
Yeah, absolutely. I easily do 80 hours worth of work a week. And I'm not just reading about it, I'm actually involved with it. So I work with industry to design new implants, design new instruments. Big thing in orthopedics is what we call enabling technology. How do we bring robots, navigation, AI into our field? So I'm, again, because of my passion to continue to push this specialty forward, I'm involved with industry to work on that stuff because that's part of my passion. So I want to be known as one of the leading surgeons um, with knowledge and making an impact
You
in
know,
this field.
I'm wondering, so when you say that you're part of like the research and development of things, in particular, when you're looking at an actual, I don't know what you call it, apparatus, I don't know, how do you do that? Like, what is, just give me an example of what is your part in it? Are you in a lab? Are you looking at materials? What are you doing?
So as a surgeon consultant with an industry company, oftentimes if you're lucky enough to be invited to be a design surgeon, as they call it, we're kind of involved from beginning to end. We're involved starting with concept. We have meetings with engineers. Other surgeons are involved, and you know, it's always the questions: where's there a gap, or what is there a need to provide? What is not out there yet? And so they, in an industrial company may bring together a very small group of surgeons with expertise in that particular area where they feel like, well, maybe we don't have this implant that can treat a specific type of need with our, in the shoulder world with our patients. You come together and you kind of work from the very beginning. We have design meetings, and then from there, the engineers do their magical work and start making prototypes for us. They also work on, biomechanical testing to make sure these are going to withstand the rigors of the FDA and natural use, and, have a longevity to it. And we go to labs on weekends on our free time, and we then trial these things. We are often doing them on either model bones or cadavers to simulate more realistic situations. And this is, can take 1 to 2 years of involvement. And we're constantly evolving, just changing, designing until we've come to a conclusion of what we feel is the best implant or best design before the industry kind of then takes it to the next step to commercialize it.
I think it is, every area of medicine is very important. I believe that. But one of the things about your area, freedom of movement, is so important. What it feels like when you can't, whether it's move your arm, move your leg, a prosthetic, etc. Yeah. That the freedom that you afford another human by the technologies that are developed, that you enable them to take care of themselves in various ways, that is irreplaceable, because everybody wants to feel like they can be self-sufficient, if not fully, at least to some extent. So, I really applaud you for choosing this particular area of medicine. But then it brings me to this question. So you're here on a show that, it implies that you've somehow along the way incurred experiences that, in spite of your achievements, in spite of your successes, got you questioning, am I where I should be? Am I enough? Can I go any further? So what's been going on with you that you can explain to us that, yep, we're not the only ones. You've experienced it too.
Yeah. I think orthopedics is a especially sensitive area for this. I'm not sure if you're aware, but in the field of orthopedics, there's only 7% of us are females who are practicing surgeons. That's nationwide. 7% of orthopedic surgeons are females.
Why? Why only 7%?
That's the big question. If you look at our training, the residents, we've done a little bit better recently, but we're only at 15% in terms of our trainees. We are, for many years, it's well established, orthopedics is the absolute worst specialty in incorporating or having females as their surgeons. We are worse than neurosurgery. We are worse than urology. We are worse than plastic surgery. Orthopedics is the very bottom on that. And the needle is only going at a snail's pace forward. I think there are people trying, but it's moving slowly. And
you don't know why? I mean, this to me is, it's kind of mystifying.
It really is. There's a lot of theories. There's a lot of, possible factors. I think if you ask a person out in the public if they think of an orthopedic surgeon, or if you see a meme of an orthopedic surgeon, what do you see? You're going to see a white male athlete, right, who is
Oh, yeah, yeah,
possibly,
yeah,
muscular, tall, strong.
yeah,
And if
yeah.
somebody were to say you're going to see an orthopedic surgeon, that's probably what pops into the any person's head, and that's a big mold that we're fighting, or we're trying to change, because that's not orthopedics.
So
But
why is that though? So I guess maybe that's how it began, but can you see why it would be so hard? Okay, so you clearly are not a tall white male. Okay, so that being the case, what is it that would be considered you'd be lacking in just because you're not that? I mean,
well, part of it is, for whatever reason, a lot of people think this is a strength specialty. You got to be strong to be muscular to be able to do this job, because we do work with instruments that tend to be a little bit, quote unquote, more manly. We use things like hammers and saws and drills. Um, you know, some people may say it's sort of a little bit carpentry work,
it
if
sounds like carpentry work.
you know. But I mean, the reality is we also use very, finesse type of instruments with like scopes and, um, again, robots and, different instruments like that. But there's a perception, and that perception even passes on to other subspecialties. So even when females are going through training through medical school, it's been shown that females are often discouraged by other females not to go into orthopedics, because it's felt to be, you don't know if you'll be able to fit in to that field.
So, what does that fit in part mean to you or to someone who's trying to enter the field? What does that mean, fit in?
For me personally,
Hmm.
fit in means you make them fit to you. You know, I don't think the normal traditional perceptions are real. I think that's exactly what they are. It's a perception or mirage, right? For me, it was, I felt that I could break that mirage and have the field fit to who I am, because my passion is orthopedics, and it's not just a brute strength type of thing. It's not just a male dominated thing, but I think we are working very hard to try to change that perception. And it is slowly improving, but it's at a slow pace.
Do you have any particular incidences? And actually, with respect to the bone, I know there's bone saws. I've heard of such a thing. I can't even imagine, but um, there are those pieces of equipment, but they're going in a human body. So the finesse portion of it, that I would say is pretty critical, and the hard bone sawing portion of it is really minimal compared to what has to happen to get
Absolutely.
right.
You're absolutely right. Anybody can use a drill, right? You can go to Home Depot and pick up a drill and push a button,
That's kind
right?
of sort of what you
Right.
do
Right.
sometimes.
I mean, that's kind of how all these tools work, right? But
Hmm.
if you look at society, again, these are gender norms. Females aren't given those tools at a young age, so they're not
True,
as comfortable
true.
using these things. Now, again, society is getting better in general with this, but it's continues to be a bit of a slow process. And so I think if we can break that perception, I think, we'll continue to make strides. A perfect example of this is if somebody were to dislocate a hip for whatever reason, an injury. A lot of people are going to think, wow, that's going to take a lot of strength to pop that back, pop that hip back in. You got to lever and pull and all those muscles and, you know, but the reality, it's actually a leverage thing. And if you understand physics
Mm-hmm.
and how to use leverage, it actually doesn't take much force at all.
And that actually is what people don't see those parts. They just
Right.
see big bone, small doctor. How are you going
Right.
to do that? And in fact, it's like, yeah, I'm using my brain to do that. That's what's
Exactly.
happening. I was
Exactly.
trained how to do this, and that's why you can move out of the way, Junior. I'll take care of it.
Right.
So, do you have, I guess, maybe an instance where you could relay something you might have experienced that might have made you say, whew, okay, did I choose wisely on this career path thing?
Yeah. I mean, absolutely. Multiple times I question myself. Even now, I question
Even now?
myself. Even now, we all go through struggles in life, and I do feel as females, we probably have higher expectations put on us, even though it's not said. And we can also be harder on ourselves. I mean, there's actually quite good literature to show female doctors, and this is not just an orthopedic thing, but this is in all of medicine. Female doctors get worse patient reviews. They get scored lower. More complaints are often about female doctors. And this is not just orthopedics. This is, in a lot in throughout medicine, and I think it's because as female doctors, we break the norm, and sometimes we are a little bit more vocal.
Mm-hmm.
We're more direct. We're more commanding, which is not, again, goes against traditional societal norms. And so people will say, "Oh, she's a B,"
Yes. Yes.
right?
Yes.
Because you, as a female, they don't want to hear it from us saying these things, where you get a different reaction from a male.
No, the exact
So
same thing can be said by a man, and nobody bats an eye. A woman says it's like,
that's just John, or that's just
exactly,
Mike, that's just who they are. But if a female says it, it's how dare she
exactly.
say that?
Then no, that
And
you're right. I mean that I know to be absolutely true.
right. And so, even till to this day, I I struggle with this. And comments are made, and it makes me wonder, am I really that bad? Do all my patients hate me?
Are you hearing this from patients, or are you hearing this from peers who want you to believe that patients are saying it?
So it's hard to know, because oftentimes it's not transparent.
Mm-hmm.
But my recent experiences tell me it's my patients are very appreciative of what I do for them. So, everyone's going to have, or I should step back. Not everyone's going to have a perfect encounter with every doctor.
Nope.
There are personalities
Yep.
that, are involved. You cannot take that out. That doesn't mean we're not trying to do our best. I think every doctor out there is always just trying to do their best for their patients, but there's definitely a personality issue. There's perception issues. There's cultural issues. Um, and sometimes that's why there's multiple doctors out there. You can always get a second opinion, or whatnot. But I do think, you know I've encountered situations throughout my career where peers have tried to make me feel less than I am, as I try to achieve greatness of being a good person and a good doctor.
And as
And
you know,
it
though,
makes you
people, when you use the term, I try to achieve greatness, that's what I hate to say it, there are some, your peers, who don't want to see that, unfortunately.
yeah,
And you would
I would
think you would
agree.
be supported.
Right. yes, you would hope that in all situations we're pushing each other up and we're lifting each other up, but that's unfortunately that's not the case
So
all the time.
you must be doing in order to, because you're still moving forward. Nothing is
Yes.
stopping you. You're still moving forward. So what is your self-talk? What is it that you say to yourself, if you're not going to get this from a peer, if you're not going to get the support you would think you would get, what do you do to support yourself to say, okay, I'm not going backwards, that's for sure. I worked too long and too hard to get here. I'm going to keep moving. What is it that you do for yourself to propel you forward?
I think I've spent a lot of time, a lot of time in my career, and more so, I think recently, looking for additional um, areas of support. So if I don't have it locally, there are societies of other professional surgeons, and I look for mentorship through there. I've looked at I've used I'm not ashamed to say I've used professional coaching, and I think every professional who is looking to develop their leadership skills can benefit from professional coaching because
Absolutely.
yeah, it's given me a different perspective, a third party view of how to approach things.
Yes.
We can always get better with our reactions and how we navigate stress. And my coach has been invaluable for that, and so have my mentors, other leaders in the field. Just having the opportunity to talk with them and ask their advice. There are amazing advisors, sponsors, and advocates in any specialty out there, but you do have to be willing to put yourself out there to look for that, as well as be willing to accept that advice.
You cannot be a professional in any industry and operate in a vacuum. You cannot do that.
Correct. Right.
And especially, I know that you do mentoring and you coach, younger individuals. I think primarily female, primarily girls. Is that true?
Most, I mean, for the most part, I've been involved with multiple initiatives. At Henry Ford, I brought in to the Department of Orthopedics something called the Perry Initiative, which is a nonprofit organization to try to improve recognition for women, uh, minorities, underrepresented people to the field of orthopedics. So they host a yearly program. It's open to all genders and races, but anyone who feels they've been, have some sort of struggles, or I should say, disadvantage. Um, we host a workshop once a year for that. I've also sponsored summer interns through something called the Nth Dimension, which is a very similar type of program where I get assigned a medical student from an underrepresented community, and they come up and work with me for the whole summer to work on research to help them with their CV. So, it's not always women for me, but it's really important for me, cultural and any form of underrepresented uh, person
Well,
should have access.
it's important because, we're human. And if we can't see us doing that thing, we don't see someone who looks like us or sounds like us or feels like us, then we figure, well, I guess that's not available to me then, when in fact it is. So
Absolutely.
what you're doing is you're widening the playing field for these
Right.
individuals so they can determine, is it a fit or not? And therefore, the coaching that you're getting, just think about it. If you just went with only the things you know and no other input, you're going to, the people with whom you speak, the ones that you encounter, they're going to have some things that maybe you weren't ready to coach them on or mentor them on, but because you've had coaching, it's like, ooh, okay, all right, I had this input. I know how to better explain or showcase to this child or this young person how they really could do this thing. You'll have more tools. So I think it's really underrated, going to others for assistance. It does not mean that you're lacking. It does not mean that you can't do it. It means that you know that you can't know everything.
Right. It doesn't, what like to tell people, it doesn't mean you're weak. It actually means you're strong.
Yes, absolutely. It means you're
You know,
strong. I'm strong
you're,
enough to say, yeah, I don't know everything, and I'm going to go get
exactly.
more knowledge so I can be of more benefit to you. And really, that's the part
Right.
where the Ukrainian me wants to duke it out and say, you want to fight me on that? So,
Right. Right. It's hard to stand down, right? I'm the same way. You never want to stand down, but what I've come to understand as I've matured is that it's not a sign of weakness. It's
no.
actually a sign of strength for your growth. And yeah.
So, with respect to growth, and really, anyone who's considering a real, and it doesn't really even have to be a doctor, but you are a surgeon, you are a doctor, and you have encountered, I can only imagine how many different instances in your career that took some strength to get through. Do you have any words of wisdom for someone who'd be listening that you feel would be like germane to your development? Like, man, this is what I live by when things get really rough or I'm really starting to question who I am. I fall back on this thing. Do you have anything?
Yeah. I mean, I think the hardest thing but the most important thing that people need to remember is just to continue to believe in yourself. If you know you're going to have setbacks, that's life. I've had setbacks. When I first applied to medical school, I didn't get in, and that was a huge question. I was like, am I worth it? Am I doing the right thing? But I doubled down, and I said, you know what? I'm putting all the chips in the basket. I believe in who I am and what I'm going to do and what I can be, and I'm just going to go for it. Um, I think that resilience and grit is what you have, and you have to remember to rely on that and rely on your belief to push forward.
Well, you said you had, you had the passion. So what you're sounds like you're also saying to yourself is, how bad do you want it then? And because you know you want it bad. And the
Right.
want it bad is not the title, not all the things that you've done, but to be able to practice your craft, to be able to practice your passion, to be able to help others in a way that is so significant. Like I said, giving them back their freedom. I mean, seriously. So that grit part is like, how bad do you want it? Oh, I want it. I want it bad.
Right.
Right?
Right. And exactly. And then are you really willing to put the money where your mouth is? You know what I mean? And do it. It's not always an easy path, especially for people who don't have those interconnections, which is me. I'm a first generation American born. My parents were immigrants. Um, Again, no family connection in medicine, no real knowledge of what the path was. It's only later you find out, oh, my friends, wow, they were volunteering in the doctor's office in high school because that's what they were told to do. I didn't have that. And so uh, I just, again, I don't know how else to say it, but other than, I just felt that I had that resilience to really do what it is I needed to do
Well,
to be able to follow my passion.
I don't know, Dr. Moo. It sounds like you also had that little, oh, don't you tell me what to do kind of thing
Yeah,
going on in you.
for sure. I never like to be told you can't, you're not good
Nope.
enough.
That's the quickest way to
Right?
get you to do it. It's like, oh,
Right.
oh, I can't do it. Okay,
Right.
then.
I'll show you.
Hold my
I'll show
scalpel.
you.
Yeah.
No, that definitely that definitely plays a role, but I'll admit it's also something as you grow older in the field, you have to learn to temper that down a bit.
Yeah. Yeah. But you know what?
You grow. It's growth, right?
Hey, you need it in your youth when you're going down a path that you know is going to be pretty interesting. You do need that pep and that vinegar in you
Yeah.
to get
That
you.
fire.
Yeah, you do need it. And then after a while, you can just have it like a smolder. It doesn't have to
Right.
be a complete bonfire.
Right. I don't
So
have to keep putting gasoline on it anymore.
no, the
I do
world can do
have,
that for us, actually.
right.
So
No, yeah.
I would say, Dr. Moo, that it's pretty clear that you've encountered a lot of things that, some of us will never encounter, some of us have encountered in a different way. But this idea of you possibly being an imposter and maybe I shouldn't be here or maybe I'm not worth it, I think you have absolutely shown that, yes, you are worth it and you should be here, but definitely not on the roster. So we raise a glass to you and we congratulate you for leaping off the imposter roster.
Thank you. Thank you. But I'll tell you, uh, I may be taking the jump off the imposter roster, but I'm going to take more people with me.
I hope you do. Then, you know what? I want to talk to every one of them because every one of you are making a difference, and we are so very, very grateful for all you do and all you will continue to do. So
I
I'd like to
appreciate it.
thank you, Dr. Moo, for taking time from your busy schedule to talk to us here.
I I really appreciate the opportunity to talk about this. It's an important topic.
It really is. And thank you to all of you for taking your time to listen to this particular podcast. I was very excited to have Dr. Moo on here. And I do hope that you do the best that you can to promote yourself and those around you because we really do need each other. And we are all worth it. Bye-bye.
Absolutely. Bye.
That's a wrap on today's episode of the Imposter Roster. If something you heard today made you nod, laugh, or quietly think, ooh, that's me, share it with someone who needs it, because the more we talk about it, the less power it has. Follow or subscribe for free on Apple, Spotify, YouTube, or wherever you're listening. And if you're feeling generous, leave a review. It genuinely helps more people find their way here. Until next time, here's to finding your way off the roster, one honest conversation at a time.